Cold open, I have to tell you about last Thursday. I made a big pot of curry chickpeas. We all piled our plates, and halfway through dinner, everyone was rubbing their bellies. It sat heavy. So I did one tiny thing. I ladled a little warm pineapple papaya digestif into a small cup and passed it around. 10 minutes later, people were smiling. The meal felt lighter, and conversation flowed again. That little moment, simple, culinary, kind, stuck with me.
That's a perfect hook. The science behind that tiny move is exactly what we'll unpack today. Welcome to Earthy Remedy, your place for real food, simple practices, and better digestion. I'm Fiona, and with me as always is Samnang.
And I'm Samnang. Listen to your body. Trust the earth. Feel the difference. Today, we're diving into kitchen techniques that actually change how your food behaves in your body. Soaking, sprouting, gentle enzymes, and a few safety rules so you try them confidently. We also have two guests, Dr. Lena Morales, a food scientist and clinical dietitian, and Indra Ratan, a culinary herbalist who brings that ancestral kitchen wisdom.
Great to be here. I'm eager to walk through the evidence and the practical boundaries, who typically benefits, what outcomes to expect, and when to check in with a clinician. Happy to be with you. I'll share how these techniques show up in family kitchens and how small sensory cues like aroma and warmth help with digestion beyond chemistry.
Quick safety framing before we go deeper. If you have fever, severe abdominal pain, unexplained weight loss, GI bleeding, or other serious symptoms, stop and seek clinical care. This episode is about small, safe culinary changes, not replacing professional medical evaluation.
Exactly. We'll give precise, low-risk instructions and name interactions like bromelain with blood thinners, so listeners can decide whether to try these things and when to talk to their clinician.
What's actually happening in the gut? Fiona, can you break down phytates and enzyme inhibitors in plain language for us?
Sure. Think of phytates and enzyme inhibitors as little locks that live in some seeds, legumes, grains, and nuts. Phytates can bind minerals like iron and zinc, making them less available for absorption. Enzyme inhibitors can slow down the digestive enzymes your body uses to break down proteins and starches, which can sometimes lead to that heavy, bloated feeling. The good news is that simple prep, soaking, sprouting, fermenting, adding an acid or heat, can change those locks, often making minerals easier to access and easing digestion.
So it's not about demonizing the beans. It's about how we treat them. In my family, soaking and rinsing chickpeas was as natural as greeting the morning. Simple rituals that soften not just the bean, but the meal.
From a clinical view, these prep methods often produce measurable changes. You might see reduced post-meal fullness, less bloating, and modest improvements in iron absorption when paired with vitamin C-rich foods. But the size of the effect varies by food, by person, and by the exact method. We also watch for certain populations: people on blood thinners, those with enzyme-sensitive conditions, pregnant folks, and immunocompromised people, because some techniques change the food in ways that could interact with medications or risks. And tradition often had elegant, low-effort ways to get there: lemon at the table, a short soak, a quick sprout in the morning sun. These are testable micro-habits. You try one small thing, you notice how you feel, and you keep what helps.
Bridge. Let's read the prep checklist aloud so people can grab what they need. Timers, a wide jar for soaking or sprouting, a fine strainer, a small pot, a thermometer for safe food temps, and the printable single-serve checklist in our show notes. Keep portions single-serve so you can test without waste.
Segment 3. Demo A, overnight soak plus fast-cook chickpea salad. I'll read the ingredient list slowly so you can write it down. Ingredients: 1 cup dried chickpeas, rinsed, 3 cups cool water for soaking, half a teaspoon baking soda, optional if your water is very hard. For the salad, 2 tablespoons extra virgin olive oil, 1 tablespoon apple cider vinegar or fresh lemon juice, 1 small red onion, finely chopped, half a cup chopped parsley, 1 teaspoon ground cumin, salt to taste, and 1 small orange or tablespoon of red pepper to pair acid and vitamin C for iron uptake.
Quick note on the baking soda. It can speed softening, but can also reduce some nutrients if overused. Use it sparingly. just a pinch if your water is very alkaline.
Step-by-step soak math. Step 1. Put your 1 cup of rinsed chickpeas into a large jar or bowl and cover with 3 cups of cool water. Step 2. Cover and let sit at room temperature for 8 to 12 hours. Overnight is perfect. Check them in the morning. They should swell noticeably and feel a bit springy when pinched.
Step 3. Drain and rinse thoroughly in a fine strainer. Step 4. For fast cooking, place them in a pot, cover with fresh water, bring to a gentle boil, skim any foam, then lower to a simmer for 30 to 40 minutes until tender. If you used baking soda in soaking, they'll cook faster. Watch the texture and don't overdo it.
Step 5. Drain, then toss while warm with the olive oil, apple cider vinegar, onion, parsley, cumin, and that orange or red pepper. The warm chickpeas plus acid and fat helps iron absorption and aids digestion. Tip: eat a single serving, about 3/4 to 1 cup, and notice fullness over the next 2 to 3 hours.
Storage. Keep leftovers in the fridge up to 3 days. Reheat gently or enjoy cold. Variations. Swap lemon for pomegranate molasses, add a pinch of sumac for brightness, or fold in cooked greens for extra minerals.
Taste and outcomes to expect. If soaking and quick cooking helped, you'll often notice less bloating and quicker transit of the meal. For iron, pairing with vitamin C sources can make a meaningful difference over time. Think measurable but modest improvements, not instant dramatic shifts.
Segment 4. Demo B. 3-step sprouting lentil bowl. Indra, take us through safe sprouting and the mini sanitation protocol.
Step 1. Rinse half a cup of whole brown or green lentils well. Place in a white jar and cover with 2 cups of distilled or boiled and cooled water for a quick soak of 6 to 8 hours. Step 2. Drain, then rinse and drain again. Lay the jar at a 45-degree angle covered with a breathable cloth and rinse twice daily, morning and evening, until tiny tails appear, usually 24 to 36 hours. Sanitation mini protocol. Use distilled or boiled and cooled water for the final rinse. Keep sprout jars refrigerated once tails reach your desired length, and discard any sprouts with off smells, sliminess, or unusual discoloration. For immunocompromised listeners or pregnancy, we recommend cooking sprouts fully rather than eating raw. Toss them into a warm bowl, sauté lightly, or steam for a minute.
3-step bowl assembly. Step 1. Warm a cup of cooked short-sprouted lentils in a pan with a half teaspoon of grated ginger and a teaspoon of sesame oil, just to warm and activate aroma. Step 2. Add a handful of chopped greens, a tablespoon of toasted seeds, and a squeeze of lemon. Step 3. Finish with a sprinkling of chopped herbs and encourage mindful chewing. Slowly taste each texture.
Why warm? Gentle heat reduces residual enzyme inhibitors and makes texture easier to digest, while the ginger and citrus provide digestive signals, so your body prepares enzyme production more effectively.
Segment 5. Demo C. Pineapple papaya digestif. Short and culinary. Keep it low dose, safe, and delicious. Indra, read the recipe slowly.
Ingredients for 1 small digestive: 2 tablespoons finely chopped fresh pineapple, 2 tablespoons finely chopped fresh papaya, 2 ounces warm water, a squeeze of lime, and a teaspoon of honey if you like it sweeter. Mash lightly and let sit for 1 to 2 minutes so the enzymes release, then strain if you prefer a clear sip. Cautions: bromelain and papain are culinary enzymes that in concentrated forms can affect blood clotting. At these small, food-level amounts, they're generally low risk for most people, but if you're on anticoagulants, have enzyme-sensitive allergies, are pregnant, or have oral sores, check with your clinician first. And never substitute medicinal doses without professional guidance.
Taste it slowly. Sip it after the meal, about 10 to 20 minutes later. Notice warmth, breath, and the way the meal settles. That's the sensory part of the test.
Segment 6. How to run a 1-week microtrial. Keep it single change and measurable. Pick one prep trick: soaking chickpeas, adding the warm sprout bowl, or the small digestive, and do it consistently for 7 days. Daily metrics. Rate bloating 1 to 10. Note stool ease: easy, normal, difficult. Record post-meal fullness after 2 hours and jot any mouth or throat irritation. Stop rules: any fever, new severe pain, bleeding, or any worrying signs. Pause and seek clinical care.
Track outcomes in a simple notebook or the downloadable checklist in our show notes. If you're on medications like blood thinners, keep your clinician in the loop before trying enzyme-rich digestives. The microtrial should be observational. Note changes, then discuss them with your clinician if needed.
Segment 7. Food Safety and Special Population Cautions. Dr. Lena, please go through the explicit sprouting sanitation steps and who should avoid raw sprouts.
Sprouting sanitation highlights. Use clean equipment. Use distilled or boiled and cooled water for your final rinses. Rinse twice daily and drain well. Refrigerate sprouts once tails reach the desired length and use them promptly, within 24 to 48 hours of refrigeration. Discard if you notice sliminess, discoloration, or off smells. Importantly, people who are immunocompromised, pregnant, elderly, or very young should avoid raw homegrown sprouts and instead cook them. If you have irregular bleeding or are on anticoagulant therapy, consult before adding enzyme-rich foods regularly. From a culinary herbal standpoint, small is beautiful. Low doses of active plants used as food are often both effective and gentle. Integrate slowly and notice how your mouth and gut respond.
Reflection and encouragement. Start small. Choose one technique and make it a single-serve habit for a week. Notice the difference. That's how we learn what our bodies prefer. Let's normalize small experiments, not big overhauls.
Quick recap: soaking and proper cooking reduce anti-nutrients and ease texture. Sprouting can activate enzymes but requires strict sanitation. Small culinary doses of pineapple or papaya can aid post-meal digestion but carry cautions for certain medications and conditions. Evidence supports modest benefits. Track and discuss with your clinician when in doubt.
If you notice improved bloating scores, easier stools, or less post-meal fullness over your week, that's a meaningful personal signal. If you notice adverse signs, stop and seek medical advice. And if you're interested in longer changes to iron status or nutrient markers, those are measurable but take weeks to months and should be discussed with your clinician.
CTA, we want to see your experiments. Try one prep trick this week. Take a photo or record a 15-60-second voice note about how it felt and tag @EarthyRemedy on Instagram or send a voice DM. Download the checklist and printable recipe cards from the show notes to make it easy.
And if you tried the sprouted lentil bowl, tell us what herbs you paired with it. I love hearing small variations. Those are the gifts of the kitchen.
One last safety reminder: red flags: fever, severe abdominal pain, unexplained weight loss, GI bleeding require prompt medical attention. For enzyme interactions or pregnancy questions, check with your clinician before trying concentrated or regular enzyme exposures.
Thanks to Dr. Lena Morales and Indra Ratan for joining us. Your blend of science and kitchen wisdom is exactly what Earthy Remedy is about. And thanks to you for listening. Start small, notice how you feel, and share your stories. Listen to your body. Trust the earth. Feel the difference.
Subscribe for more practical, evidence-aware recipes and rituals. We'll put full recipes, the sanitation checklist, and a 1-week microtrial tracker in the show notes. See you next time.